the evidence-based model really is looking at that informed development of an approach to grading a healthcare evaluation in its best evidence, but also that is a standardized, uniform, and practical in providing a quality of care. But it also really requires filtering through clinical expertise, both of the clinician or the peers, patient, and essentially that integrating that with the best evidence and the measures of patient values to build on a clinical reasoning and therefore on to a treatment plan, or whether that might be a guideline. If you had the opportunity to listen to the talk provided, you would have seen that they're seen the critique of evidence-based medicine, but also I think it's important to understand that the power that this platform can provide when it's applied mindfully with that awareness. So evidence-based practice, as opposed to evidence-based medicine, which is sometimes criticized for its perceived restrictive nature. So evidence-based practice can almost be seen as a bit more flexible and inclusive in the nature of evidence, where an observational study, for instance, may be held at that same value as a random clinical trial, RCT. Really, it's again, it's this evolution of challenging the classic hierarchy of evidence, and arguably it can capture that patient experience and different practitioner attitudes that they therefore go on to inform a clinical decision making or guiding public health policy. So another iteration is practice-based evidence. There really is a global shift towards the patient-centered care model of medicine that is really refocused on the individual person to indicate efficacy outcomes and build the evidence base. There's a centre called the Centre for Oxford Centre of Evidence-Based Practice that actually has elevated N-of-1 trials, which are essentially, as they say, there's this one enrollment, but the interventions can be controlled and randomized, however it may be, but these N-of-1 trials have been elevated to the highest level of evidence for the treatment efficacy of an individual. So this potentially provides quite a unique space for practice-based research in complementary medicine to almost evolve or disrupt the current narrative of what constitutes evidence. And overall, a takeaway is that we're all human and we all have a philosophical perspective that with an awareness of understanding that philosophical framework, we can understand the paper, how we interpret the data, the evidence, and also have an understanding of where that paper is coming from in terms of that philosophical framework. And it really is through this continued inquiry that the evidence base will evolve and really assist in guiding clinical expertise and patient-centered care that is becoming more of that global focus in medicine.